Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Hello, listeners. I am so glad that you are joining us for this series on school nurse emergencies. I'm Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Now, this series is broken up into 2 episodes with 2 distinct goals. For the first episode, what we're going to focus on is some of the most common emergencies that school nurses encounter, their causes, and those initial response strategies. And then in the second episode, we're going to focus more on strategies for managing school emergencies and what that collaboration is going to look like with school staff. Joining us for this discussion is Sandy Moritz, a very experienced school nurse. Sandy, thank you so much for joining me for this discussion.
Thank you, Candace, and welcome everyone. And thank you for attending my presentation today on school medical emergencies. Oh yeah, Candace, jump right in.
I was just going to say, I'm just excited to hear about your expertise and your
Oh,
insight in this area.
well, it comes with education and experience. And I will tell you, 30 plus years in school nursing, but who's counting, right? And today I do a lot of professional education for school nurses. So it's my professional pleasure to be spending it with my school nurse colleagues, my school nurse buddies, as only one school nurse to another can really understand what happens in the school health office. Because I have so many people that have this myth in their mind that school nurses, we're sitting there waiting for our patients to come in, waiting for the next student to need us, having our time for lunch and breaks. No, that's not school nursing. We are extremely busy, and school nursing is getting even busier as our school health offices start to look like a miniature emergency room.
Wow. And see, I'm not well versed in school nursing coming from the hospital,
Sure.
intensive care unit. It's so different. So I'm really going to be learning a lot from you today, especially around some of these more common emergencies that you're going to be discussing. But I know for myself, I don't face things like asthma attacks and seizures and diabetes outside of the hospital doors. And you and other school nurses, those are things that you face. So, being a school nurse, it seems like you would have different protocols and expectations and needs that you're going to need to meet that I have no idea. I have no understanding of. Am I interpreting that correctly?
Yes, you hit it on the head, Candace, because school nurses are solo acts. We're the only person medically trained in the school. We might, if we're lucky, in a large environment, say we have a whole lot of high school students with a big population, we might have an extra nurse working. But basically, we work on our own. And that means anything that walks through that door, whether it's a student, a staff member, or a visitor, any age group we have got to respond to ethically in our role as a school nurse. So we can't call in the doc in the emergency room or the respiratory therapist or the pharmacist or even another nurse or an aide to help us move a patient, move a staff member, treat an emergency. We must know what to do when the time comes on our own.
And I haven't even thought about all of the different age groups that you would have to take care of. I think about the age groups as the different schools. You have high school, middle school, but you're right. You would be responsible for so many different ages that might walk through your
Yeah.
door and so many different people, even visitors. So
Hmm.
that was something. Thank you for pointing that out. And what I want to point out before you really jump into, some of the questions that we have today is the complexity of care of so many students. It just seems like it's continuing to increase.
Yes. When I first became a school nurse, it was very interesting. Had very few medications to deliver regularly students. Didn't really have any emergency medications. Didn't have an AED. CPR was just becoming a thing. And so things have evolved that sometimes the school nurse is the only nurse. For instance,
Mhm.
a student came into my office one day and she already had a very high temp elevation, was vomiting, had vomited on the bus, and was obviously very ill and needs to be picked up and go home before she even started her school day. And I
Mhm.
asked the silliest question I could have ever asked her. which I no longer ask a student. Why did you come to school today? You're so sick. And she looked at me puzzled and she said, we don't have a nurse at home. So I realized, and it's continuing to be evident, that sometimes parents send students to us to get that first set of eyes to evaluate that child.
That's a good point. I haven't even thought about that. But what insight that little girl, it was a little girl, right? That
Mhm.
little girl had to even just say, my mom didn't know.
Right.
She didn't realize. Well, I wanted to highlight some statistics too, just to
Okay.
show the complexity of the care that's being provided to our students. But approximately 1 in 12 children, and these are US statistics, but 1 in 12 children, they have asthma, making it one of the
Mhm.
most common chronic conditions in school age children. Food allergies, 1 in
Yeah,
13 children in the US. And so if you break that down to classrooms, that's roughly 2 students per classroom.
exactly.
Approximately 10% of the students in the US, they have an injury at a school that requires medical attention. Playgrounds, playground-related injuries account for more than
Mhm.
200,000 emergency room visits annually for children under the age of 14.
Mhm.
And this one was 193,000 Americans under age 20 are estimated to have diagnosed diabetes, with type 1, of course, being the most common form in children and adolescents. But we are seeing a rise in type 2, which we deal
Yes.
with that a whole different way. And then
Yes.
there's 470,000 children who have epilepsy. And so you're going to need to be equipped to handle seizure emergencies. And
Yes.
what I found even more alarming was that only 40% of schools have a full time nurse on staff, which
Yeah.
really is going to impact the ability to respond effectively to these medical emergencies. So, what are your thoughts on these statistics?
It's alarming, and if you read them too often, you might need a mental health day, and not go to school. But really, school nurses approach their day as anything can happen, and we know that we have to be flexible. So if we had screenings scheduled that day, say vision screenings, and we had an
Mhm.
emergency first thing in the morning, we're probably going to have to cancel or delay whatever else we had planned that day. So a school nurse's day, and I actually enjoy this about the job, is very different every day. It's full of excitement for everyone sometimes, and we want to be prepared to deal with anything we need to when it walks into the school health office. Absolutely.
Hmm. Yes. Now, I know that, kicking off this podcast, I listed a couple of common medical emergencies that I think of, but what are the common medical emergencies that you face often?
Well, you mentioned the statistics on asthma and
Mhm.
allergies. And so those are two big respiratory emergencies that are commonly seen by the school nurse in students and staff members. Common acute bronchospasm, usually due to asthma, anaphylaxis due to severe allergies, overdoses, also a respiratory emergency, in addition to
Mhm.
choking, status epilepticus in a student with seizures. Those are some of the most common reasons ambulances are called to schools, in addition to injuries. And then choking is the fourth leading cause of death, especially in young children. And in addition, sudden cardiac arrest is the number one cause of death in student athletes in the US
Mm.
today. And then students with diabetes may also present with emergent situations due to severe hypoglycemia.
Yes. When we were talking about some of the complexity, how much more you're seeing the complexity of care, I just it took me back to so every year, or most years, I try to donate some time to a camp, to a kids camp for a week.
Okay.
I am not a peds nurse. I just, here's some popsicles, here's some water, here's some Tylenol. But I have noticed the complexity in care that I'm seeing these children come in with. There's a lot of ADHD meds that are coming in way more than when I first started nursing is when I first started going to this camp. So it's been about, oh my goodness, 20 years now. Um, but the amount of medications, the amount of injections that I am now giving to children, are you seeing this complexity at school as well?
Well, absolutely. And I'm glad you mentioned camp nursing because anybody that's a school nurse has probably had a little bit of a stint here or there in camp nursing.
Mhm.
And it's very similar to being in a solo act in a school, but even more remote. And so that makes it even more of a concern depending on what the situation may emerge as a true emergency. Then you, as the camp nurse, you have to keep that person stable until the
Mhm.
ambulance arrives, which could be an extended period of time. So camp
Yes.
nursing is very similar to school nursing that way. And I would also encourage anyone listening to this that's a nurse to consider being a substitute school nurse to find out if school nursing might be your second career or a pathway you take after you're done in intensive care or med surge or whatever it might be. Call your local school. We need substitute school nurses. So, yes, the complexity of care. We have to continue to keep our education up to date in school nursing. And we actually have to find trainings outside the school nurse bubble, meaning that we're not in a hospital where they say, okay,
Mhm.
attend this in service. It's mandatory. No one is telling us to attend mandatory in services on topics related to school nursing. We may
Right.
need to keep up a certain number of credits to keep licensure, but there's really no, you have to take it in school nursing. But you really do have to do it because if you don't keep up to date in school nursing, you may find yourself in this situation where you're not quite sure what to do. And that is not a situation
Mhm.
any nurse wants to find himself or herself in.
Absolutely not. Yes, I've had to dig braces, out of lips. Um, there's things that I never thought that I would have ever seen, and it's just really through experience and critical thinking that you're able to really figure out what to do on your own. Um, and
Exactly.
speaking of that, how do you prioritize and assess these emergencies when they occur, when they come to you?
Well, basically, we are nurses first. And so we will look at
Mhm.
the airway, breathing, circulation, and then add the D on the end for disability. What is the reason they're having a problem with their airway? And then, of course, there's the CAB, circulation, airway, breathing. And now, commonly, some of the organizations we receive our training from are calling it circulation, airway, breathing defibrillator.
Mm,
Um,
yeah.
so we have a lot of acronyms out there that can assist us in trying to focus on what we need to do when an emergency occurs. In every emergency, school nurses have to decide one of three things. This is emergent. Call 911, get the AED, and get your team in place to assist the school nurse.
Mhm.
Or it's urgent. The school nurse does his or her assessment, decides what to do as an intervention, and then observes, is this intervention working? Or do I need to keep them longer and observe them for a while or do a recheck? Or, yes, I know I can call the parent to take them into emergency care or to the orthopedic doc. Or does it develop into that emergency? And now you do need 911. So you may have
Mhm.
the urgencies, the emergencies, and then the non urgent that come in. Typically, I would see about 60 students every day towards the end of my full time career. And even though some may disagree with me, pediculosis is not an emergency. So
Why would they disagree with you?
some have in the past, but let's not get into that. Another assessment tool in emergencies, specifically for children, is called the Pediatric Assessment Triangle, commonly known as PAT. This is a tool that the NIH recognizes as a great tool for a quick assessment. American Academy of Pediatrics encourages those that take care of children outside of the hospital setting, which includes school nurses, to take their course, which introduces the Pediatric Assessment Triangle. What is that? So it looks at three parts of emergency care. One is, first of all, the appearance. And I think school nurses are really good at this. We hear someone coming down the hallway to our office. We pop out to see what's happening. Oh, we need to glove up, or we're going to go greet them, or get a splint, or whatever we think we might need. So, appearance. How are they appearing to us? And we see students many times for successive years. So, we sort of know what their normal behaviors are some of the time. Are they crying? Are they able to make eye contact with us? Are they able to be comforted? Do they throw themselves down on the cot and curl up into a fetal position and not want to speak? Are they being social with their neighbor on the next cot? So we look at their appearance from head to toe and we decide, okay, here's what I'm seeing. Here's what I'm going to do based on appearance. And then the second part of the triangle is work of breathing. Are they having to work to breathe? They come in and grab a hold of your desk and lean over to try and get more airflow into the lungs. They may be cyanotic. They may have a rapid respiratory rate or a low respiratory rate. So you take a look at their work of breathing. Are there retractions that you can see through their shirt? Do you see neck retractions and hear stridor, which is a red flag, especially in children, and it could indicate choking or anaphylaxis or some other disorders. So
Hmm.
we're looking at their work of breathing. And then finally, circulation. 2 second capillary refill in children is normal unless their hands are very cold and they've come
Hmm.
in from, outside recess. Are they cyanotic? Are their nail beds blue? What else do we see? Tachycardia is a cardinal symptom in an emergency in children. So we're going to probably check their pulse. Maybe eventually we'll get to vital signs depending on what the emergency requires from us hands on and how much help we have. And vital signs are vital, but they're not as vital as when I went to nursing school and they said, take vital signs every 15 minutes, no matter what. Everybody got
Right.
vital signs 15 minutes.
Hmm.
And now you'll notice when the emergency crew comes in with the ambulance, normally the first thing they do is put oxygen on them to decrease that work of breathing and increase the
Hmm.
oxygen going out into the circulation. So, those are some of the assessment tools I think that are really important for school nurses to think about. The pediatric assessment triangle, your ABCs, your CABs. Is it urgent,
Hmm.
emergent, or non urgent?
Yes, that was really good. Thank you for sharing those tools and really breaking down that triangle. I'm not, and don't have a lot of experience with peds other than my 1 week at camp nurse. Um,
Mm,
but, it's really good just to hear you break this down and to put it in the terms of pediatrics. So thank you for being so detailed with that.
sure,
Um,
absolutely.
one of you mentioned a couple of things. You mentioned allergic reaction, anaphylaxis. You mentioned asthma. So I want to first break down asthma. When you see a student having an asthma attack, I have a couple of questions just
Mhm.
about this.
Okay.
And my first question is going to be, how do you know who has an inhaler? Do they always have their inhaler with them? Does the inhaler live with the school nurse? So how do you manage an active asthma attack and to know that that's what's going on? And does somebody run get you? Do you at camp? I have a radio, you know. So how does that work?
Yeah. So, students with asthma, known asthma,
Hmm.
school nurses will request and sometimes demand an asthma action plan from the parents and the physicians. And normally they're presented at the very beginning of the school year or at the beginning of someone's new diagnosis for asthma. And on there it will say, administer albuterol typically 2 puffs with a spacer every
Hmm.
4 to 6 hours. And we're now asking for doctors many times to add 2 more puffs to that. If in 5 to 10 minutes albuterol is not effective, administer 2 more puffs of albuterol to check for effectiveness. Because maybe they
Hmm.
didn't prime their albuterol, maybe they didn't inhale it properly, hold for 10 seconds, use their spacer properly. But we also want to give the albuterol a chance to work. It does take at least 5 to 10 minutes to be effective.
Hmm.
So we want to follow the asthma action plan if they have one. Now, if they have one, they will be presenting albuterol either in nebulizer form or as a multi-dose inhaler to the school nurse. Depending on the age of the child, we encourage that they self-carry their inhalers to school and that they have them available at all times wherever they go, because not everybody
Hmm.
has a full-time school nurse. Maybe the
Hmm.
teacher has to be involved with administering or observing that albuterol being administered. So we try to have a plan in place if possible. Albuterol in place, either with the child or with the school nurse in the office, if there's a full-time school nurse there. Or if our school physician, gives us stock albuterol, we even then have that alternative if a student forgets their inhaler at home, if they self carry. It is a first event. We can treat, waiting for the ambulance.
Hmm.
If the inhaler isn't working or empty or whatever reason, we have a backup plan with stock albuterol. Okay,
Okay.
so we really like to encourage getting stock for an acute asthma attack.
And if
So
someone has one that you maybe they haven't been diagnosed with asthma, how do you treat that?
Yeah, so I've had some situations with cold urticaria where you develop hives after being in the cold, especially if you're running,
Hmm.
and then also develop wheezing, and you present to the school nurse. So, at first I was like puzzled. Why is this child coming in off the playground? It's cold out
Hmm.
there. They're not eating
Hmm.
food. Why do they have hives? And I'm hearing wheezing in their lungs. So I had stock albuterol. And after realizing that the wheezing wasn't just a minor wheeze, but something significant, I was able to administer that under our school physician's order and stock medication. And then that student did go out by ambulance because it was a first event, and we wanted to
Hmm.
know what's really causing this. So, stock medications will sort of fill the gap. But the
Okay.
other thing to remember during an emergency with asthma, it's very unpredictable. There
Hmm.
are about 200 or 300 deaths in children with asthma every year. And it isn't just in the student that isn't getting adequate health care or having a long acting bronchodilator, in addition to their rescue inhaler. It can happen to any child with asthma. Very quickly, the airway can close. And once that happens, it's very unlikely that the albuterol will be able to be inhaled into the lungs to open the airway. And then you're in an emergent situation, a race
Hmm.
against time, so that the child doesn't go into hypoxia. Yeah.
Right. That's scary. It's a very scary time.
The
Um,
only thing I
w-
wanna add about asthma before we move on is that,
yeah.
don't just meter the child, give the child their medication. If they're having wheezing, even if it's minor, have them sit and wait a while you're doing other things in the office probably, and then in 5 to 10 minutes, listen to their lungs again. You wanna auscultate. So your one of
Hmm.
your really important tools to know how to handle and use is a stethoscope when it comes to, children and wheezing. So if your skills aren't up to date on that, or you're a new nurse and your
Hmm.
background didn't involve that, then, go online, take a course on auscultation, and pick up your stethoscope and start listening to children's lungs as they present with asthma. And you will become an expert in wheezing in no time at all. So you want to
That's really
meter
good.
and monitor. You want to monitor them
Yeah.
before you send them back to class and they think, okay, she sent me back, I'm all right. Especially young children will think that. And maybe they're not. And we need to watch
Right.
them for a while.
That's some really good points there. Now, can we talk about the same thing with allergic reactions, anaphylaxis?
Absolutely. Anaphylaxis is very scary. I
Yeah.
have witnessed it in schools maybe 15 times and have had to give the epinephrine autoinjector. And a couple of times it was a rebound effect and had to give it a second time while hoping the
Hmm.
ambulance would get there very, very soon. So,
Right.
yes, we have to know that the only treatment for anaphylaxis is epinephrine.
Hmm.
Benadryl does not stop anaphylaxis, none of the other meds, steroids, etcetera. Not that we would have steroids in schools, but
Hmm.
frequently it has happened in the past more than recently that the first medication given during anaphylaxis has been Benadryl, and that's a mistake because epinephrine has to be given first and fast so that we don't have organ failure and organ death in anaphylaxis. So we've got to be experts in anaphylaxis. And I think most school nurses are pretty up to date on those skills. They know that they need trainers for all of their epinephrine delivery devices. Now we
Hmm.
have a new epinephrine delivery device that children and parents are going to love even more called Neffy, which is an
Yes.
intranasal device. So I would say, go to Neffy before Neffy comes in your office on your first student and learn how
Hmm.
to use it. It's very simple. There's no needle. So again, there'll be no needle sticks accidental. There'll be no
Yeah.
lacerations because the student moved and the needle gave them a laceration instead of an injection. And it's much simpler training of your staff also during anaphylaxis.
Yes. Very good points.
So the staff training on the symptoms of anaphylaxis is very important because they may eat something in the classroom and have their first
Hmm.
symptoms in front of a staff member or a teacher. So if they don't recognize that they're having anaphylaxis early on and the student doesn't either, there's going to be a delay in the child getting to
Hmm.
the nurse. If they eat something on the bus or have an allergy anaphylaxis on the bus, not all bus drivers are going to be trained or be required to give first aid. Some will just be required to pull over and call 911. And then again, there's another delay in the epinephrine being given. So,
Hmm.
again, we also see about the same number of deaths in children for anaphylaxis as we did for asthma, 200 to 300 deaths per year. And these are avoidable deaths with knowing what the symptoms are, having your auto injector or your intranasal device now with you at all times. These can be carried very easily. The new Neffy can be carried like this, can hold two
So it has a clip.
intranasal devices. Yep, it has a little
Yes.
clip for the belt versus the auto injectors, which are a little bit larger, a little bit more difficult to have
Mhm.
maybe when you're out on the sports field doing some sports after school or during PE class. And there are many types of auto injectors. So the nurse needs to know about each one of those. And then, of course, we also have the AVQ, which tells you what to do when you open it up, which is really nice. And it's
Yes.
the first auto injector for infants up to 33 pounds. Okay, so
Oh,
we have an infant device now too.
yeah. Very nice. There are a lot of injectors that come in. In my week at camp, I get a ton of different ones, and then I have to make sure that every counselor, if they go off campus with their students, that they have their inhalers, that they have their injectors,
Yes.
not just their medications. So all of that is really important as well for camp nursing and anytime you're around pediatric patients, even if you're not a peds nurse, even if you're not a school nurse, just knowing what to do when something happens. Something will happen at some point, and if you are there,
It will
being able to be the
absolutely
person.
happen. Yes, absolutely happen.
Mhm.
I would also say that to school nurses and those that do trainings for those that need to learn how to use the auto injector are staff members.
Mhm.
So I'm a Pennsylvania school nurse, and the laws differ from one state to another. But many of our states say the school nurse has to do the training on how to use the auto injector and
Mm,
teach staff members what the emergency signs are so that they
right.
know what to do and when to use it. And keep in mind, if you're not sure if it's anaphylaxis, especially if you're not a health professional, and you do give the epinephrine, it's not going to harm the person. They won't be harmed from the epinephrine. They may have some minor side effects, but they're not going to be harmed. So if you think it's anaphylaxis, give it. And as the
Right.
school nurse trainer, never take your real epinephrine injector to the training. You can imagine why.
Yes, I
Sometimes
can.
things get mixed up during the training, and
Yes.
somebody will pick up the real EpiPen, give themselves a shot in their thumb accidentally, not knowing they have the real one instead of the trainer.
You sound like this has happened before.
It's happened before. It's happened to
Yes.
some of my staff that I worked with, and I was, "Did you remember I said not to take that to the training?" And they didn't after that, that's for sure.
Yes. Oh my goodness. Now, I want to touch on fractures and sprains on school grounds because, being outside in the playground, especially elementary students or even school athletes, I'm sure you
Yeah,
see this.
yes. So, we want to make sure that when we do an evaluation, let's just say upper and lower extremities, for instance, that if we release them to go get an X-ray, and we don't have X-ray eyes in the school health office, that they can get there safely. So that means
Hmm.
some sort of splinting because we don't really know if it's broken. I have
Hmm.
seen injuries that I thought, oh, that's probably just a sprain or a strain, and send them out. And the next day they
Hmm.
come in a cast, or I'm sure
Hmm.
it's fractured, and they come back and they said, no. It's not. It's just a bad sprain. Especially ankles are very difficult to analyze. So we have to assume that we're going to treat them like it's a fracture till we know otherwise. If there are those cardinal signs of, edema, and lack of mobility or tingling in the fingers or the toes, extreme swelling. You can sometimes look at, for instance, a Colles fracture on the wrist. It will be like in the shape of an S, and you're like, no, that's
Hmm.
probably fractured, but I can't really say it's fractured. I can say
Right.
I suspect it. So, what sort of things do we have? Well, your ambulance crew is really great for trainings, and they said, look, just have large and small pillows on hand. Say someone comes in with an upper extremity injury, they can put their arm on here. It's already a position of comfort, and it's providing some splinting just by using that pillow. And then the nurse can examine, is there edema? Do I need to get an ice pack with, a paper towel
Hmm.
barrier? Look at their fingers. Did we need to take a ring off their fingers? Because I do see a lot of swelling. What part of their arm is broken, maybe?
Hmm.
Okay, we're going to keep them on this pillow and secure it with an ace wrap or large, wide gauze, and the child can go off very safely from A to B to get a simple x-ray of their upper extremity if there are no underlying disturbing
Hmm.
symptoms like tingling, cardiac or neurological symptoms, or you aren't sure if the parent, first of all, the parent might not be able to come in and transfer them. You might have to call the ambulance to do that. So they're
Hmm.
in a position of comfort. You can also use the pillow for suspected ankle fractures. And again, you do the same thing, give it some comfort, some support, and secure it with the ACE wrap or the wide gauze, and send them off by wheelchair from your office to the parent's chair, or to the parent's car, excuse me. Again, A to B safely. We're not going to allow weight bearing on any possibility of a severe strain, sprain, or a fracture in the lower extremity, especially the ankle, and any suspected injuries that could be a fracture in the tibia, fibula, or femur. The large bones of our bodies go out by ambulance. It is very difficult to securely splint those large bones, and we
Hmm.
can also keep on hand something called SAM splinting, which is available on a roll. You cut it to the length of, let's say, the arm, and you bend a piece over, comfort for the arm to hold on to, like this, and it goes up to the elbow. And you secure this also with an ACE wrap or some wide gauze, and you can put a barrier and ice right on it, and off they go. You can put them in a sling from A to
Hmm.
B safely if you're going
Yes.
to splint and send them out by parent car, for instance. So I would say having those supplies on hand are very, very important. And yes, a lot of injuries do happen at school, and we don't always know if it is fractured. Parents will ask you all the
Hmm.
time. Parent came in one day and asked me, "Is my child's arm fractured? They fell at the roller rink on Friday night." And I said, "Well, let me take a look at it." I looked at it, and all I said was, "It's in the shape of an S." And the parents said, "Oh, they need an X-ray, don't they?" And I, "Yes." And then we got them splinted and
Hmm.
on their way.
Yeah.
Using wheelchairs for all transfers of lower extremity, below the knee,
Hmm.
very, very important. We don't know if it's fractured. We're not going to have further injury happen by allowing them to weight bear. That's really, really important.
Yes, very. And I do want to point out to our listeners, we do have our podcast on our YouTube channel that you can watch for free as well. So if you want to see some of the things that she is showing, you can check out our YouTube channel for that. I do want to touch on diabetes, diabetic emergencies like hypoglycemia, hyperglycemia, because I know that is something we see a lot as well in schools.
Yeah, so a lot of our students with diabetes will come from their diagnosis at the diabetes clinic, medical center, pediatrician's office, what have you, with something we call the diabetes medical management plan. And it will specify, for instance, what insulin they're getting. Maybe they'll have a pump, and it will talk about, the amount of insulin they're supposed to use based on how much carbs they're eating, or if they're exercising before and after lunch or what have you. And also, they may have a glucose monitoring device on, their upper arm typically, or abdomen. Say, for
Hmm.
instance, one of the Dexcom, and there are many types of those glucose monitoring devices. And those devices typically are connected to the school nurse's iPad in the school nurse's office, and sometimes to the teacher's phone or iPad. And we will get alerts if they're dangerously low. And hypoglycemia is the danger part of diabetes. Hyperglycemia, yes, we don't want to see students with consistently or very, very high blood sugars, and they can become an emergency, but typically are caught over a period of time with the diabetes managers saying, okay, we need to increase their insulin, we need to look at their diet again, and so on. But acute hypoglycemia can happen very abruptly and very quickly, and we need to treat it right away with at least 15 grams of carbs. And those you can use, glucose tablets, you can use Smarties, you can use Skittles, you can use juice packs, but you need to have everyone that may have contact with a student with diabetes have the availability of glucose. So if we
Hmm.
have an evacuation or a lockdown and someone with diabetes student is walking through the hallway and they say lockdown, a different teacher, not their own, may pull them into their classroom saying you need to get in here now, and the student's glucose is back in their desk. So staff members need to have at least 15 grams of carbs available for anyone that might present to them. They go to a different teacher for math, they go to art class, they're out in the playground. We need to
Right.
make sure we can manage severe hypoglycemia. Really important.
Yes, that's really good information. The last thing I really want to hit on is seizures, managing seizures.
Yes. So, seizures are more common than we think, and we have generalized seizures, which affect the whole part of the body, which used to be called tonic-clonic, and we have
Hmm.
focal seizures, which are more a specific part of the brain. And physicians will typically try in the student's seizure action plan to manage these seizures with medications first, the least invasive. Try to manage them with that. If that doesn't work, they'll typically go into things like a vagal nerve stimulator, which is implanted under the clavicle and communicates sometimes to a magnet to activate it when a student or a person feels they're getting are going to have a seizure, that prodromal period, or the
Hmm.
new ones will activate themselves when they notice a spike in the heart rate, and they will automatically activate it, which stimulates the vagus nerve to shorten the seizure or stop the seizure, hopefully not going into the emergency status epilepticus, where seizure continues and doesn't stop for at least 5 minutes, and that's a true emergency. So we have meds to give them in school also. An intranasal med is Voltoco, looks just like Neffy and the same sort of applicator
Hmm.
intranasally. If a student has a seizure in a classroom, staff need to know how to prevent injury when that student may fall, collapse, what have you, onto the ground and, be thrashing and hit their head or other parts of their body, during the seizure. So
Hmm.
a lot of education to our staff and knowing what the doctor and the parents want the nurse to do during an emergency. Emergencies during a seizure include those that don't stop, status epilepticus, those that occur to individuals who are pregnant,
Hmm.
seizures that occur in water. Those are all true emergencies. Seizures that occur if you have diabetes, that's an emergency. You should be calling 911 because they may need further care than we can actually give them.
Right.
So knowing what those exact emergencies are that we need further care for are really important. And if it's a first event, child's never had a seizure before, we're going to call 911. We don't know
Hmm.
what's
Hmm.
happening in the brain or what the underlying cause is. But Voltaco is a real great saver because it's diazepam intranasally instead of the old form of diazepam for students with seizures, which was a rectal gel. So you can imagine rectal gel, intranasal. What would you like for your child? I'll let you
Right.
decide. But
Yes.
it's much simpler to deliver.
Yes. And I also could think of when you were listing emergencies as a student who's running on the playground and hits their head and has a seizure.
Exactly.
Yes.
Exactly. Yeah.
So these are all really great, just breaking down these emergencies that you see and looking at them from that school nurse perspective, and rather than that where I have everything at my hands and everybody at my hands in the hospital setting. So this has just been really a great refresher for me to rethink
Oh, thank
how
you.
do I care for these emergencies outside of a hospital setting. So thank you so much for being here with us today for this first episode, Sandra.
Thank you, Candace, and to all the school nurses and those who are thinking about school nurses and camp nurses included. Have a wonderful School Nurses Day on May 7th. Thank you for being a school nurse or considering being a school nurse because we really do need you. Thank you.
Absolutely. Yes. Well, that is the end of our first episode for our School Nurse Emergency series. So, to our listeners, please take time to join us for episode 2, where we will be back to discuss strategies for managing school emergencies and what actually collaboration is going to look like in that school setting. So, please join us.
Thank you.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.